It is my pleasure to be with you all here today, and thank you, Will, so much for this opportunity to provide a few remarks with you. As you have already heard probably many times this morning, the President and First Lady did reignite the Cancer Moonshot a year ago and set two new ambitious goals. The first is to decrease the number of cancer deaths by 50% over the next 25 years. And the second, as Will mentioned earlier, is to improve the experience of people living with and surviving cancer. And to do so, they are calling on everyone to do their part, including federal agencies, private companies, healthcare providers, patient groups, philanthropies, and so much more. And it's not just here in the US, but across the globe. It's why the ambitions of the Cancer Moonshot now extend far beyond our own borders, especially as the burden of cancer falls heavily to lower and middle income countries. And looking around this room today, because I was just reflecting on the train ride up here that a year ago at the Global Health Catalyst Summit in DC was where we first publicly committed to taking the Cancer Moonshot global. Seeing all of you here, seeing so many people that we have now engaged with, sharing your progress, your ideas, your actions, sharing your time, seeing your passion and your dedication, it's a reminder of just how this community has really rallied behind the President's call to action. And it's why the Cancer Moonshot has broadened our scope internationally. And our work is to focus on equity and collaboration. Again, a hot word today, thereby increasing access to prevention, screening, treatment, and care for everyone around the world facing a cancer diagnosis. And we've already made great strides. At the US Africa Leaders Summit event hosted by the President this December, the First Lady announced by the Cancer Moonshot $300 million of commitments from both the US government and from the private sector partners. These efforts, some of them you will hear from now, include strengthening the public health infrastructure, building resilient health systems, investing in health workers, as well as funding for robust and impactful initiatives across the African continent on cancer prevention, screening, treatment, and research. If there was any doubt that we can make a significant difference in the lives of cancer patients across the globe, or reach audacious goals like eliminating cervical cancer in our lifetime, then these examples of commitments that were made and that you will hear from in just a moment should put to rest any of them. Because if there's one thing that we have heard very loud and clear this past year, it is that together we can make a difference. And so I'm very excited now to welcome Jennifer Dent to the stage as we will hear from a number of these commitments and the progress they are delivering. Jennifer, over to you.
Good morning and almost afternoon. It's a real pleasure to be here again at the Global Health Catalyst Summit, and we've had a great start to this meeting. And I love the theme of our meeting this year, the Cancer Moonshot, collaboration, public-private partnerships. And this panel is going to highlight some of the examples of how the private sector is contributing to advancing the Cancer Moonshot and taking the Cancer Moonshot to Africa. So I'm going to ask all of our panelists to just file up now, and as I just speak for a moment about some of the progress and general work that we've done since the US Africa Leaders Summit in December. So as many of you know, BBGH launched the African Access Initiative in 2017 with 5 ambitious goals: to advance sustainable, demand-driven access to high-quality and more affordable cancer medicines, to strengthen healthcare infrastructure, to train oncology healthcare professionals working across the cancer patient management pathway, to facilitate African-led research to fill the data gap, and to support advocacy. We've made tremendous progress since we launched AAI in 2017, but there's still much work to do. And in December of last year, President Biden hosted the U.S. Africa Leaders Summit, where the theme during that summit was public-private partnerships and engaging with the private sector and recognizing the many contributions that the private sector could make to strengthening partnerships between the United States and Africa across sectors, including cancer control. And we heard from Dr. Catherine Young about the First Lady's, Dr. Jill Biden's commitment. And I actually witnessed that commitment when now President Biden, then Vice President Biden, hosted in 2018 the Biden Cancer Summit in Washington, D.C. to speak about launching the Cancer Moonshot at that time and really changing cancer as we know it. And at that summit, we had the opportunity to speak about cancer in Africa. I actually just traveled from Nigeria after meetings with the 8 regional cancer centers, cancer leaders, First Lady, Her Excellency Dr. Zainab Bagudu, the Minister of Health, and to understand what Nigeria's priorities were in strengthening cancer control and cancer care in that country. And we've transitioned from that time in 2018 to now we have President Biden in his role and the First Lady committing to take the Cancer Moonshot to Africa. So we have tremendous momentum and support at the U.S. government level. We have many activities and commitments and actions that are ongoing at the private sector level that we're going to hear about today. And these commitments are actually driving progress toward taking the Cancer Moonshot goals to Africa. And I think importantly, what Professor Will Ngwa, what Will is able to do with this meeting is bring together a very diverse group of leaders to bring very strong representation, leadership in cancer control, cancer leadership, policy, and treatment from representing so many different countries in Africa, people that are making such a difference, like we heard from Dr. Beatrice, Dr. Miriam this morning on the continent. So now I want to introduce some of our speakers here today. I think we'll start, we have one guest that is going to zoom in. We have Dr. Chris Reddick, who's the Vice President and Head of Research and Development, Health Equity at Takeda. Chris is going to join us by Zoom, and Chris is going to speak about some of the activities that Takeda has ongoing that are actually moving forward and making real progress in taking some U.S. innovations, fostering research, and training oncology healthcare professionals. And just know, Chris has been one of our collaborators and partners on the African Consortium for Cancer Clinical Trials, and I think many of you in the audience know Chris. So over to you, Chris.
All right, thank you, Jennifer. And I also want to thank Will for the invitation to join this panel on such an important topic. So very good to be able to join you all today. Takeda has been a long-term and proud partner with many of you here in advancing cancer care in Africa. And we have taken a holistic approach to this, so not just focusing on one aspect of care, so whether it be clinical trials or diagnosis or treatment, we've really tried to align it with our corporate philosophy of what we call PTRB. So that's P, putting the patient first, building trust with society, reinforcing our reputation, and developing a sustainable business. So with that as our kind of guiding philosophy, we opened our first office in sub-Saharan Africa in Nairobi in 2016, and since that time, we've continued to build infrastructure and embedded this philosophy within our organization to make sure that it's sustainable. So we've now developed a Center for Health Equity and Patient Affairs. We have an Access to Medicines team that is setting up patient assistance programs to provide affordability-based access in sub-Saharan Africa. And more recently, we've also implemented a diversity in clinical trials office and team that is really looking at improving the participation of underrepresented investigators as well as patients in our trials. And as Jennifer was saying, one of our big areas of focus has been partnerships on assignment to strengthen healthcare systems through scientific and technical capacity building. And this is all along the patient journey, again, from disease awareness to diagnosis and to treatment. And one important part of that work has been working with partners like ABGH to provide training, not only around how to conduct clinical trials, but the big gap that we've understood is moving from training to actual application of that training, real-world application. And we've been doing that through a program called AC3T, which is the African Consortium for Cancer Clinical Trials. And really the goal of this work and this program in partnership with BBGH is to allow investigators to address issues in their countries and in their communities, but also develop the capacity and infrastructure to participate in global clinical trials as well. And so over the past several years and up to date, this program, AC3T, has supported over 17 cancer clinical trials being conducted by African investigators in African sites. So this is just, a snapshot of kind of our philosophy, our commitment in this space, and some of the partnerships and work we've done to date. So I'll turn it back over to you, Jennifer. Thanks.
Thanks very much, Chris. And just to highlight, we'll hear a little bit more about the Hypo-Africa study that is one of the studies that Takeda, through the AC3T program, is supporting. We'll hear more about the Hypo-Africa program that Will has been leading and is ongoing with, I think, all 3 of the PIs representing sites in Africa and playing leadership roles in that study during the Catalyst Summit this year. So thank you, Chris, and thank you to Takeda for the support of the 17 research programs that are ongoing, and many of the participants are here this week. I'd like to turn it over next. I'd like to introduce Dr. Chitkala Kalidis from Bayer. Chitkala is the Global Head of Oncology and In Vitro Diagnostics Regulatory Affairs and Oncology Sustainability at Bayer. She has Bayer's active in Africa and also planning to do quite a bit more. She's going to talk about some of those activities and plans, and again, just to highlight that very much in alignment with the goals of the Cancer Moonshot, and will be major contributors to the goals of the Cancer Moonshot through those programs. Did you want to come up here?
Good morning, everyone. Thank you, Jennifer, for the kind introduction, and Catherine for this opportunity to discuss what we are doing at Bayer as part of our Oncology Sustainability Initiative. I think there's tremendous synergy here in terms of what we are all trying to do as part of the pharmaceutical industry, along with our partners in the public institutions, as well as patient advocates. And all of this being part of the platform that the Biden Moonshot offers is a wonderful opportunity. I'd like to specifically mention 3 projects that Bayer currently has ongoing in Africa. And I very much appreciate that 2 of these have already been mentioned as part of the Biden Moonshot communications that came out in association with the Africa Summit in December 2022. The first one is our liver cancer program that's ongoing in Egypt. we picked liver cancer in Egypt because there's very high burden of liver cancer in Egypt, that it's one of the leading countries in terms of number of cases of liver cancer due to a variety of reasons. And we have been in Egypt in terms of having a commercial presence for a long time. But still, what we noticed was that the outcomes that we saw in terms of patient outcomes when it comes to liver cancer was not what we would observe in the developed countries. And so it was not a question of whether our drugs are available in Egypt or not. It wasn't just the drugs were not reaching people when they need them. So what we decided to do was to embark on a healthcare system strengthening initiative where we worked with the primary health centers as well as the secondary centers that were serving the rural as well as the inner city communities where a lot of people did not have access to equitable cancer care. And we linked these centers to the tertiary centers, which were the real liver cancer expert centers. And this was through a process of capacity building at the different centers and linking them to the tertiary centers, where we're working on creating centers of excellence that can serve the citizens of Egypt, so local capacity building. And beyond Egypt, the centers of excellence are also interested in serving the broader African community. So that is one example, and it is also, this was possible through a collaboration with the Ministry of Health and Population in Egypt, and it was part of President Sisi's 100 Million Healthy Lives initiative. So it's wonderful to see that that is also, that has been brought under the fold of the Biden Moonshot initiative as well. So to just give you some numbers, we have trained over 100 centers all across Egypt, and then we have also trained hundreds of healthcare professionals with respect to liver cancer diagnosis and treatment. And we've also run patient awareness camps where patients first are now, they're aware of what those early signs are and what they need to do, where they need to go to get care. And so overall, this is, I would say it's about healthcare system strengthening and creating equitable ecosystems for cancer care in general. And we feel that we can build on this and serve other patients as well, that is, patients with other cancers as well. So this was the first example, and quickly moving on to our initiative in Ghana. Bayer has also had a long-standing presence in Ghana, sub-Saharan Africa. We had the Ghana Heart Initiative, where we built capacity for cardiovascular care. And this seemed like a wonderful opportunity to really leverage the infrastructure that we have in Ghana to really serve the needs of patients with prostate cancer. Why prostate cancer? And we all know that patients with Western African ancestry have higher risk factors or heightened risk of prostate cancer. And it was also recognized by the government of Ghana as part of their national cancer plan that prostate cancer is a serious burden to the country. So what we are doing right now is partnering with the Korlebu Hospital, which is a leading hospital in the capital city, Accra, as well as with the National Health Insurance Authority of Ghana and the government of Ghana. And importantly, we're also partnering with the German government to build capacity for prostate cancer care. And we're also advocating for prostate cancer coverage by the National Health Insurance Authority in Ghana. So we are very pleased with the progress that has been made and look forward to continuing the collaboration both with the Ghana government as well as with the government of Germany. And the third project, and I'll finish with this, is actually a multi-stakeholder collaboration with Duke University, NCI, NIH, Arizona University, as well as the National Brain Tumor Society. And this is about creating capacity locally in Africa and also in India in collaboration with centers in the US. And we call this the Global Pediatric Brain Tumor Network. And the idea is to really build capacity for caring for pediatric patients with these very rare tumors and understanding how centers with low resources are able to manage their caseload and exchange lessons learned with centers in high resource settings. So we have had a kickoff meeting for this, and Duke is playing the central coordination role, and we hope to have results fairly soon and read out results from this project. What I'd like to mention is that Duke is already very active in Tanzania, and we're starting with a pilot in Tanzania and also including centers in India that we already work with that have a strong interest in glioblastoma and pediatric brain tumors in general, and trying to link all of these centers through a common digital tool so that there can be opportunities for virtual tumor boards and also sharing lessons learned in a manner that would be in line with privacy requirements in the US or EU, so highest standards in terms of privacy, patient privacy, and confidentiality, but being able to share best practices across regions using a common digital tool and by connecting experts across different centers. So look forward to continuing the collaboration, and also thank you, Will, as well, for the opportunity to discuss these the progress that's being made in collaboration with so many stakeholders, both internal to a company and also external to the company. Thank you very much.
Count for sharing a variety of programs, and just everyone to know that the speakers will be here for the day today, so you'll be able to find them to discuss, ask questions, and explore additional collaboration opportunities. Next, I'd like to introduce Natanya Jennings. Natanya is the Director of Global Health Equity Platforms at Bristol-Myers Squibb, and she is going to speak to a couple of examples of BMS programs and partnerships with Africa. Natanya.
So thank you, Jennifer, and thank you, Catherine, for this opportunity to share a bit about what Bristol-Myers Squibb company is doing on the continent of Africa. I do lead the Global Health Equity Platform, which sits within Global Policy Advocacy and Government Affairs, and it's a pleasure to see you all. In reference to ongoing activities at Bristol-Myers Squibb, I'll mention three. In particular, one that I'll start with is one that is sponsored by BMS for BMGH and focuses on pharmacist education. As a pharmacist myself, I recognize this as a need in sub-Saharan Africa, having visited multiple times and also served as a trainer myself. Through this program that is innovative and offering this form of training, it's not just training, but it's also offering a form of mentorship. And this is also unique in that Bristol-Myers Squibb, for the first time, is able to participate in this mentorship as well. In addition to this, we are also supporting the Innovative Cancer Medicine Program, which is a partnership between Bristol-Myers Squibb, two nonprofit organizations, and another pharmaceutical company. And why is this important? It's been mentioned multiple times this morning about the need for innovation in cancer care in sub-Saharan Africa, and recognizing this as a manufacturer of such medicines, it's important that we be part of the solution rather than the problem. And in doing so, Bristol-Myers Squibb is providing product as well as some clinical expertise and funding to support in a project focused on operational excellence in 2 sub-Saharan African countries. And through these programs, we're hoping to learn more about the cancer excellence centers within sub-Saharan Africa. And this was also included actually within the fact sheet for the Cancer Moonshot program in December of 2022. And last but not least, I want to say that the educational component of cancer care is also something that I've been hyper-focused on as a clinical pharmacist myself, but I also have had multiple visits to the continent. And one of the areas across the board that I've supported since starting this position in 2020 has been focused on education. And how is it that we are upskilling or providing this in a way that's sustainable? And one such way that we have found is partnering with major nonprofit organizations that do this on the daily. So eCancer.org comes to mind, Take Care for All, and a few others that offer innovative ways to offer education to clinicians where they are at a time in which it's most convenient to them. We have today trained around 20,000 healthcare providers on the continent of Africa, and there's certainly more to come in the near future. Working both in oncology and hematology, as well as beta thalassemia, it is a challenge, but in fact, we're here to meet it, and looking forward to partnering with more of you in the future. Thank you.
Thank you, Natanya, and I think particularly Dr. Biden, being an educator herself, would really appreciate the training and the many education programs that you are leading, I know, at BMS. I'd like to ask Josette Gamudu, who's the Executive Director of Health Equity at Merck, to come up and share some examples of the work that Merck is doing as well in building public-private partnerships and executing programs to improve cancer care in Africa.
Great. So good morning, everyone. It's certainly a pleasure to be here. Thank you, Catherine. Thank you, Jennifer, for the invitation. So I'll just start off by saying that Merck has really elevated access to health and access to health care as a pivotal part of what we do. And so within that broader rubric and umbrella of access to health, the company has put forward 3 big, bold commitments. One is we will advance health equity for 30 million people within low to middle income countries and also within the U.S. underserved populations. Second, we will enable 100 million more people to access our innovative portfolio globally. And that certainly is inclusive of the continent and sub-Saharan Africa. And thirdly, we will make sure that our portfolio reaches at least 75% of the globe. And so we've put forward these bold commitments, and as an organization, I assure you that all parts are working towards really thinking strategically about how we reach and exceed these goals, and certainly the way and manner through which we do that has to anchor on public-private partnerships. So that's been a very, very pivotal beacon and part of just how we go about really ultimately extending access globally. And so when you think about these commitments, we've sort of thought through the approach from a 2-pronged strategy. The first is really about equitable access and thinking about what we can do from an affordability standpoint. So specifically, as it relates to cancer and expanding access to cancer care within the continent, we've been very thoughtful around how we work with government agencies to really accelerate registration, how we think about new financing schemes and reimbursement models, and then also how we think about working with African-led distributors and suppliers to build their capacity to be able to deliver these innovative treatments. On the second front, and I think a lot of us have really talked about the importance of health system strengthening, and so we've certainly equally leaned into that as well. And so from a health system strengthening standpoint, we've really focused, at least within the continent, on thinking about the end-to-end cancer continuum. And we're doing this across breast cancer. We're looking at this very closely at how we partner with organizations to support that end-to-end continuum along cervical cancer. And we're excited to think about how we can expand our reach and our focus beyond breast and cervical cancer. So doing a lot of work around awareness, around education, but then thinking about access to preventative services, thinking about really early detection and the linkage to care. We have a few patient navigation programs ongoing really on the continent that is so focused on speeding up that linkage to care and cutting down the time to treatment. And then, of course, thinking about workforce capacity building that undergirds, quite frankly, all of these efforts. And so I'll give you one example of work that is underway, and certainly this is just one example of many examples that we have. So we were excited to collaborate with PEPFAR, the United Nations Program on HIV and AIDS, Roche, and who am I missing? A lot of different partners coming together to really think about how we cut down cervical cancer among women who are HIV positive and who have AIDS. As you know, there are about 11 million women within the continent right now that have HIV and AIDS, and they're 6 times more likely to develop invasive cervical cancer. And so through this effort, we've thought about how you build and link into the current HIV treatment pathways, but in doing so in a way that really elevates the focus on cervical cancer prevention and really enabling access to cervical cancer screenings. So through this effort, there are about 12 countries within the continent that are part of this. We've been able to deliver close to 6 million cervical cancer screenings. About 300,000 women have received treatment for precancerous lesions, and certainly there's a lot of really great progress that we've seen across the board. So we're excited about this initiative, we're excited about expanding this initiative across the continent. And then I'll just end with saying that patient navigation is so critical, it's so important, and then certainly working with different organizations to think about how you build the internal digital capacity within leading cancer institutions on the continent. And so we've been partnering with a number of organizations ultimately focused on that. So thank you for your time, and certainly looking forward to engaging with you all and happy to take any questions.
Thank you, Josette. And we will have time for questions once the speakers have all had a chance to share some of their initiatives. Josette, you touched on a couple of, I think, of really important points that were brought up today. The affordability that you're focused on for access to care, which is so important. But also, I think it's really important to look at integrating and strengthening supply chain systems and access systems within the continent and not creating additional layers, but strengthening those systems that work now and working with those systems. And I'm excited to hear as well about the impact that you're making on cervical cancer treatment and screening. Next, I'd like to ask Therese Lin, Vice President of Public Affairs at Electa. Therese obviously comes with a really critical area of cancer care in radiotherapy, very complementary and required to work with the pharmaceutical and other companies that bring important technologies. So, Therese, please.
Hi everyone, thank you for having us here today, and thanks specifically to Will and Stephen and all of you behind this wonderful summit. I just wanted to start out to say we are such impressive work to bring us all together. I think collaboration is key, and for us as Electa radiotherapy provider, we also see the importance of this, and we are spending more and more time building these kind of coalitions, being part of them, driving the agenda, thinking about, like previous speakers said, also how can we get political will, how can we make them affordable, So we're trying to explore all different kinds of collaborations to see how can we make it easier for countries, for customers, whether public or private, to actually invest into radiation therapy. So thanks so much, and we are doing our part, trying to be part of what you're doing, but also on our own, organize these kind of summits, and we're actually having one in Vienna next week, together with the IAEA and the Swedish Embassy and many others, to continue to talk about the European ground shot. So applaud also to the US administration for launching the Moonshot and also extending it globally, because it's a global world we're living in. But for us as Electa, as previous speakers said also, for us, access to care is actually our core mission. It's in our strategy. Our strategy is called Access 2025. So based on that, you can imagine a bit what we are working on. So we have 3 pillars on that. It's access to care, it's elevation of care, and it's patient-centric care. And we have really strong KPIs that we are followed up upon to deliver on these 3 pillars. So that's very much a focus on our daily work across the business. Of course, the foundation for us is technology. So we are delivering on innovating cutting-edge solutions, trying to make the equipment smarter and easier to use, because we know workforce is a big problem, not only in Africa, but actually across the world. So that's a very common problem. And in radiation therapies, it's also critical to decrease the number of treatment sessions that get. It's called hyperfractionation. It's well stated out in the Lancet Oncology Commission for Sub-Saharan Africa that Will and others here were part of making, where it stated that hyperfractionation is key for access. And we have the solutions for that already today, but we're also constantly driving innovation forward. So now, for example, we're working in a global consortia, talking about collaboration, with 120 hospitals, trying to push towards treating prostate cancer, for example, with only 2 hospital visits. And that's quite a big deal when we make that happen, because today that might take 28 visits to the hospital. So that will be beneficial for both patients, for providers, but also healthcare system in large. The patient part, there we have developed an patient engagement solution app, you can say, that patient can self-report daily outcomes during their treatment journey, and by thus, that data being shared, that can be used for improved and predicted care for that individual patient, but also for the big data sets. You can learn a lot about treatment effectiveness and new treatment protocols. So that's also very exciting. Well, so technology is the key, but without sufficient human resources in place, fewer treatments will be done. We were just summarizing our fiscal year, which ended a couple of days ago, and I'm very proud to see that we have been trained more than 34,000 healthcare professionals this past 12 months. And we are certainly wanting to increase that number even more for next year. And that's being done on our own, or most often together with partners. And we are working with many fine US hospitals here, and many of them share our interest in global health. So we are exploring that area more and more together to find partnership from US to other parts in the world using their expertise. And something we're also very proud of is the Electa Foundation, which we launched about a year ago. And Lacey is here in the audience today. We'll speak a bit tomorrow at the awards dinner about the impact she and her team has been able to do the last year. But that has been, so the foundation is an extension and complementation, you can say, of Electa's sustainability agenda. Work with prevention and screening is something we are not doing as a daily business. But so important to diagnose early. And during the first and only year so far, 2022, they started a cancer screening, cervical cancer prevention screening project in Rwanda, and screened actually 20,000 women in a rural district. That went really well, and they are now extending it to the rest of the women in that district, which is 35,000 additional women being screened starting this summer. In the fall, they're also starting a similar project in Uganda. So we're very happy to see this kind of test pilots we're trying, and then trying to scale them together with partners moving forward. But you will learn more from Lacey speaking with her today, or listen to her tomorrow night. So I hope we have brought forward the message that this is super important for us, and we are focusing everything we can do here to work for equitable access to quality radiation therapy in underserved regions. And they can be wherever. They can certainly be in Africa, but they can also be here or in Europe. So we are not excluding anyone. And just to finish with a recent example of how we do work is with the Aga Khan Hospital in Dar es Salaam in Tanzania, where we are partners in just one of those PPPs, where Aga Khan will treat patients under the public insurance, under the Ministry of Health, And we are providing our solution, but also comprehensive training packages where the hospital staff will receive training in Turkey, but also in site in Tanzania. So always a big piece of education coming with it as a practical example, and very recent. So thanks so much for listening, and please reach out and talk with me, Lacey, or John here on Medical Affairs. Thank you so much.
Thank you, Teresa, and thanks for sharing some of those great examples of the important work that Elect is doing even beyond your core technology. And I have a feeling you and Lacey will be hearing from maybe Ghana, Ethiopia, and Kenya during this week to encourage you to take some of the great programs to those countries as well. So I actually recognize that we've actually kind of nicely skewed our gender of our panel in a very positive direction without even trying, but I do, as I'm looking at this panel, I'm very impressed with the gender balance. But we did balance a little bit, so we have Eric as our kind of anchor male on the panel. Eric Royals is the president and CEO of Nanocan Therapeutics, a company that Will is also very involved in, supportive of, and Eric is doing some great work and he's deeply committed to partnerships on the African continent and bringing technology to the African continent. So I want to turn it over to Eric now to share some of the work that he's doing. Thank you, Eric, for being our gender balance.
Yeah, good morning. Thank you, Jennifer. As somebody with a mom and 3 sisters, I'm totally comfortable with the crowd, so, and very happy to see it that way. So, very excited to tell you about some of the work I'm doing with Professor Inwa, who, in addition to being the brains and the passion behind this great movement, was also a very astute inventor, and during his time as a professor at Harvard Medical School, Professor Inwa really created what we believe and what we hope, and what I've certainly made a big bet on is a potentially disruptive technology in the cancer space. Our company, Nanocan, we are preparing to go into phase 1 clinical trials in castrate-resistant prostate cancer, doing the trial at Johns Hopkins, Dana-Farber, and Northwell Hospital. We hope to open the trial early next year. I'm praying that the technology works, because if it does, our commitment as a company and my personal commitment to the continent is that we will quickly move to open trials in Africa as well with this technology. And part of the promise of the technology is Professor Inwa figured out a way to deliver immunotherapy in microdoses in the microtumor environment, and a slow release of immunotherapy, but using about 1/600 to 1/1000 of the amount that you would get systemically through an IV. And so with those dynamics, we believe we can actually make immunotherapy affordable in Africa. And so we'll see and so my commitment, both to Professor Inwa and starting this company 3 years ago, and is that we're committed to make sure this technology gets to the continent of Africa. I've been to the continent many times before this endeavor, and certainly with Nanocan to speak with potential collaborators in Kenya, in Ghana, and then throughout the continent. And so that's our hope, is that once we open the trial in the U.S., hopefully we'll get some good data, good safety data first. We'll move quickly to extend the trial into Africa. The second thing that we're working on, and this is more, again, my personal commitment as an entrepreneur, as somebody of African descent, is really committed to helping Dr. Beatrice Wafe to build her oncology center of excellence in Ghana. And so that's a very important project, and I hope, So we are committed to helping that. I'm personally committed to continue to provide personal financial support, not through my company, but my company will, we want to make her center one of the key partners of extending our trial in West Africa. And so that's sort of the second project we're working on and committed to. And then finally, as a healthcare investor, I do have another company. I won't get into that here because it's nail cam where I spend all my time and passion. But I have another company that does have, it has a breakthrough, and I'm committed to getting that product over to Africa. So I have a company, we're in clinical trials in England right now, and we have we've proven for the first time that we can deliver iron through the skin through a transdermal patch, and also vitamin D and zinc. And so we've opened a trial in England. It's going well. That technology, again, I'm committed to getting it into Africa because there's obviously a big iron deficiency issue particularly with women. And this is an easy solution. You put on our patch, leave it on for 8 hours, and you get a very high dose of iron without the side effects that you would take from oral supplementation. And so again, that's a little bit of a sidebar, but it is part of my personal commitment to bringing innovation to Africa and to the continent. And so thank you, Will, for putting this on. Thank you for all the other contributors for the work you're doing in the continent, and for all of you for participating. Thank you.
Thank you very much, Eric, for sharing some of those exciting developments you have ongoing. Does anyone in the audience have questions or comments? I think there must be a question out there somewhere.
Hi, I'm Emily Kobayashi from the Clinton Health Access Initiative, and appreciate the partners spotlighting the work they're doing. And it stuck out to me that there's ground shot, there's moonshot. You know, it's all part of the strategy. The question I had wanted to pick up a point that Dr. Josette made about the Go Further initiative, which was the partnership between Merck and the US government and others. And I wanted to know, as we talk about Cancer Moonshot 2.0, what are the prospects for other public-private partnerships like that, where we have companies coming to the US government, the government putting in money as well, to be really ambitious and to think about cancer treatment in this 2.0 phase. Thank you.
Thank you, Emily. Is that question directed towards Josette or Catherine or the whole panel? Does anyone want to take that?
Hi, Emily. Good to see you. Yes, of course. I think as we think through the strategy for the Cancer Moonshot and how we engage globally, we are absolutely open to ideas and partnerships of this kind. I think public-private partnerships are really at the bedrock of what we do, particularly as we fill in gaps that the government may not be able to do by itself, but can amplify and support, especially the good work that's already being done and executed in countries in Africa. So we'd love to talk further if you have ideas, and I think also for us to think through how we can work with different agencies, particularly as we were talking internally earlier, with like PEPFAR, for example. How do we make sure that there is a focus on closing that loop with cancer at the back end of some of those programs as well? So there's a lot of opportunity, and I think the time is now for us to start thinking through very strategically and intentionally about how we capitalize on those opportunities in the best way possible. But we'd love to maybe talk further with you as well after this. Anybody else on the panel?
I mean, yeah, I think we are incredibly excited about prospects, right, of replicating, I think, what we saw with Go Further. I think truly a lot of sustainable, proven models that yield a level of impact and outcomes have been models where you are bringing so many stakeholders together, right? And I think one of the things that has been so clear to us is we were initially focused on a lot of implementation-oriented activities, but you need government there because now you're thinking about the translation to policy. And through policy, right, hopefully you can have even broader impact at a national level. So certainly I think we're very excited about what else we can, really explore with the administration and with other government officials and in a lot of the countries that we are certainly engaged in working in.
Other questions?
Thank you so much for all the speakers, and thank you for Dr. Will for including me. I am a physician from Colombia, Panama, and I have seen in Latin America how the percentage of cancer is increasing and how many families are devastated by this. So by me seeing all these initiatives, and I thank the White House for taking this initiative and spreading education, helping countries, and the goal of this Global Health Catalyst Summit is eliminating disparities and granting access to communities that they don't have the resources to educate physicians, doctors, and they don't have access to research. So I really appreciate this initiative because I know that for the countries and all the professionals that have the resources and the knowledge, all these knowledge and resources will reach out to us to help our populations. So more than a question is I want to show appreciation to the White House and to Dr. Will and the organizers of this amazing summit. Thank you.
At the back.
Yep.
Excuse you.
Good morning. I'm Paul Mobit from Cameroon here. I'll be speaking tomorrow. My question to the panelists, especially the companies, that when you develop, I just need to understand how your policy for the different Africa. Africa is a big continent with 53, 54 countries. And for me, having been on the ground in Cameroon, it feels to me like you have a single policy for the entire continent, which means you are not customizing your policy, for instance, in Central Africa, like Cameroon, where what you do in Cameroon is going to be different from what you do in Ghana. The policy that works in Ghana absolutely not work in Cameroon. So you need to customize it. And what I see working on the ground in Cameroon is that you have probably the same policy for every African country which doesn't work. I know Russia has been in Cameroon, they've not been successful. I mean, the other one actually driving the pharmaceutical needs of the patient. So the patients end up not getting anything at the end. For instance, in Cameroon, I believe in Chad and other countries. So my recommendation is that you guys need to customize your policy for the different African countries in which you work, because the general policy will absolutely not work. I can tell you about Cameroon, and I'm sure the other countries have their different issues they have to deal with.
Prof. Mobit, maybe I can just respond for the panel. I think that with your leadership at the Cameroon Oncology Center, and I know from speaking really with all of our panelists here that they are committed to working with leaders like you who are championing and delivering excellent care to patients in the communities in Cameroon or other African countries. So I would encourage you to speak to some of the panelists at the break. But I think everyone will agree with me that it's absolutely critical to customize your approach and your model and the partnerships that you establish in every country, including countries as like Cameroon. So, any other comments?
Thank you for that comment, and I fully agree with Jennifer. In fact, this is one of the things that I actually appreciate Jennifer's feedback very much on this, because we've spoken about this when I mentioned the examples I did mention Africa, but if you see the examples, they are customized to each of the countries. We look at the disease burden. In Egypt, it's liver cancer. In Ghana, we're looking at prostate cancer. While we are very much focused on Sub-Saharan Africa as a region, we are taking a customized approach, looking at the disease first, what is in the National Cancer Plan for the country, and definitely working with local experts, as Jennifer mentioned, is a priority because we want it to be translatable locally, and we don't want to go in with solutions that are, you could consider them as canned solutions. No, we don't want to do that, and that's why feedback and guidance from experts who are already in the region is extremely valuable to us, and we seek that as part of the collaborations we have as well.
Thank you. I also appreciate that question very much. At BMS, we also don't recognize it as solely a continent, but looking specifically at countries, and certainly partnerships is essentially the way that we've been working, not just on the side of education, but also on the side of understanding the patient population and who knows them best. And as other panelists have said, working directly with clinicians in the community as well as other respected personnel, ministries of health, et cetera, has been the way in which we have worked directly with countries and not approaching Africa solely as a continent.
So I think on that, I think that was a great question actually to wrap up this panel. We are at time. Again, I'd encourage everyone to reach out to meet with the panelists during the day and the afternoon. I know it's lunchtime now. I think everyone was encouraged this morning to visit the beautiful Penn campus that's just around the corner. I'd like to thank all of our panelists for sharing some of the partnerships and initiatives that they have ongoing in really achieving President Biden's cancer moonshot, making important contributions, not just talking about what they're going to do to partner with oncology leaders in Africa, but actually I think we heard some great examples of all of these companies actually taking action, delivering impact, and building true partnerships to understand the needs, the priorities, and then executing on those partnerships. So I'm very excited. I know, Catherine, I don't know if you have any final words, but I know that we're excited about just the impacts and being able to point back to some of these impacts that companies are making and working with both nonprofit, academic leaders. And I want to thank Will for the opportunity to host this panel today, and look forward to meeting all of you and having discussions over the next few days here in beautiful Philadelphia. Thank you. Thank you, everyone.
Thanks a lot, Jennifer. We actually have one more session before lunch. And I also want to mention something that we actually, so Catherine has been very great at this engagement. So one of the things that we're going to receive today is also the engagement to the diaspora, and also, including here in minority communities in the United States. And one of the key people that we discussed to engage is really the athletes. And we have today with us, I want to acknowledge, NFL stars, former players, Calvin Johnson, who is a Hall of Famer, sitting right behind there, together with Rob Sims, who is also another NFL star. We're going to have a chance in the afternoon, I think, since we're running out of time, to have an engagement, plus Catherine is also going to be here, about how the White House is engaging diaspora and athletes like you. So with that note, I want to thank again the panel, and we'll welcome Dave.